In today's presentation, we're actually going to look at how informed consent looks like for culturally diverse and spiritually diverse clients. And we'll explore some of the clauses, the concepts, and considerations that we need to take into account, especially as counselors. So today we're going to look at informed consent from the view of a school counselor. And in this case, that means Omar would be my client, and I would be working with his father, Reza, and his mother, Farah. And currently, right now, what's happening is there's a conflict between his mother at home, and some of this is being highly influenced by his father, Reza. We know that there's going to be some strict gender roles that are occurring, and now that Omar is 11 years old, he's also in a transition to middle school. So this is also going to be cause for some concern because added stressors can cause academic impacts and impact his social relationships as he's developing through this peak time in his life. And as a counselor, I also have to be aware that I have a very limited view on Islam. And I also have to understand that the mother has a differing interpretation of what her roles are and how she views Islam compared to her husband's more traditional views. So in order to better understand the family dynamic, we kind of have to look at Islam just a little bit. And so as a counselor, it's important for me to be confident in knowing just some of the basics. So first, let's look at the 5 pillars of Islam. The 5 pillars include profession of faith, prayer, alms, fasting, and pilgrimage. So all these are important tenets to each of them. Now, in Islam, the role of the father is usually the leader, provider, protector, educator, playmate, and friend to both his son and his wife. The role for the mother is usually primary caregiver, teacher, creator of the home, playmate, and the individual who makes the foods that are passed on traditionally. Now, children also have a role within Islam, and it's incredibly important because they are the gift from Allah. Their role is honoring and showing kindness to their parents. It also states that they are to repay the parents' sacrifices and are responsible for maintaining the kinship of their family. So Omar has a lot of pressure on his shoulders, so I can see why some of the tensions are occurring. But he also has to remember, as the servant of Allah, that he should remember the tenets and his responsibilities as a child. So we may want to explore that with him a little bit further. So when clients first enter into counseling, we really need to explain what the process is. So in this case, we would go over the risks and benefits, the limitations, what the client's rights are, confidentiality, and what termination will look like. And in this case, we also have to think about the cultural components because these are going to be imperative to tailoring the consent in order to help Farah, Reza, and Omar. So we have to think about spiritual integration. We have to think about the ethnic identity of the individual that we're discussing or working with. We have to think about the family dynamics because although we're going to be working primarily with Omar, we are going to have communications between Farah and Reza. And then we also have to think about maybe exploring some of the family of origin. So when we talk with Omar, we really need to discuss where his family comes from. What are the main belief structures? So these are all things to consider. And honestly, most times when Muslim families come in, the mother and father are also dealing with many things like the oppressed Muslim woman stereotype or the aggressive Muslim man. These are all things that can impact how they deal with certain things. And then again, there's also resistance to assimilating or having cultural shifts that occur. So these are also important to discuss within the family dynamic. So we're briefly going to go over some of the counseling procedures, confidentiality, and resources that I would recommend. In this case, Omar would come into counseling once a week at a designated time, but we will not impact his school schedule. So he'll be either requested through a teacher in emergencies, but otherwise we'll only pull him during elective times. And then sessions will be about a half an hour. And again, we're not going to impact his normal school schedule. We are going to discuss some of the limitations of confidentiality and the parents' rights when we start establishing counseling. So we're going to explain to Reza and Farah exactly what's going to occur, how we're going to discuss things, and that Omar mainly is going to be allowed to discuss things without sharing that information with his parents unless he feels comfortable. However, in the discussions, if there's something that comes up that's concerning, especially when it comes to abuse, or maybe there's some mention of harm, then confidentiality will have to be broken. And then the parents of the student have a right at any time to terminate counseling, but it must be in writing because we always want to keep good documentation. Now, when it comes to parent resources and referrals, I want to make sure that I back these referrals up. So in this case, I would definitely recommend family counseling in conjunction with him coming to see the school counselors. It's just something to help the family as a whole. Another thing they might want to look into is spiritual leadership guidance. Another thing is encouraging family activities and quality time. And then finally, looking into support groups. So we might want to find resources in the community who are Islamic based or have some type of impact on family support. And these could greatly benefit them and Omar. So the following are mentioned for guidelines for the counselors, especially in cases like these. So these are all the ethical and legal considerations. The first would be to identify Omar has an inability to give consent because he is a minor. The next will be that we are going to be dealing with multiple clients. Even though Omar is the primary, his mom and dad are still going to have a role within the counseling process. Another is receiving gifts. While in most cultures it is respectful to give gifts, we also have to explain to them that it is not appropriate in the counseling setting. Another thing is we have a responsibility to clients, so it will be imperative to explain to them what my responsibilities are for them to take care and not cause harm. So at any time, if they have something they want to discuss, that it is my responsibility to listen and to make sure that those changes occur. The other thing is I have a responsibility to the parents and legal guardians. So while Omar is my client, his parents are still his primary caregivers. So I am not going to take anything away from them. They are the ones that have the power, but I want to work with them. We want to be collaborative. Next is the release of confidential information, and this will come in for referrals. So if they find my competency is not accurate enough, then they can seek referral to someone else. And I will make sure that I release the most imperative information. While not everything, it will be enough for the family counselor or whoever they go to next to be able to help Omar, Farah, and Reza. There are also boundaries of my competence. So I have to realize that I lack in some areas. So I am going to have to develop those, which comes next into continuing education. So it's going to be incredibly important that I continue my education and understanding of diverse groups. And in this case, I would want to expand my understanding of Islam. And I also want to go over proper referral and ensuring that most of my resources are endorsed or they actually do offer some help. So I want to make sure that I keep good communication with them and understand exactly how they're helping the people I refer. So thank you all for your time. I hope this was informative and that this helps you guys in pursuing informed consent with clients of diverse backgrounds.